Public health has a long and robust history, over 120 years, as a matter of fact. Public health has helped the world overcome smallpox, polio, the Spanish flu, cholera, and many, many other health conditions that have contributed to severe illness and death over the course of time. Public health has grown into a sophisticated infrastructure where federal, state, and local public health are weaved and networked together. It is a professional discipline where degrees are earned at the bachelor's, master's, and PhD levels. There is profound expertise and experience in disease control and prevention, environmental health, and community health promotion. Public health nurses, nutritionists, sanitarians, epidemiologists, scientists, and health educators care deeply and work tirelessly to protect and improve the health of all residents in our county. Public health practitioners can be trusted to perform their important work in the same way mechanics are trusted to fix your car engine. A heart surgeon fixes an ablation, and a pilot safely flies you across the country. As your local health officer, I am passionate about healthy communities, have professional degrees and many years of experience. I am charged with leading this health department to meet excellent standards set forth by our Public Health Accreditation Board, as well as execute the 10 Essential Services Framework. I was hired by and accountable to the Lewis and Clark City County Board of Health, but most importantly, accountable to the people who live in this county, as this is who we exist to serve. Your local Board of Health is appointed by county commissioners and consists of both local elected city and county officials, as well as community members, including some with environmental and medical backgrounds. Your Board of Health is tasked with supervising the health officer, overseeing the strategic direction of the health department, and considering rules and regulations needed to ensure the public's health is upheld. The Board of Health has used an open and public process when developing regulations. After a thorough process where staff engage community stakeholders to draft, the board then reviews and opens public comment. Feedback from the community impacted by the regulation is heard and often incorporated into the regulation before final adoption. These regulations are reviewed and updated on a regular basis to ensure they still are protecting the public's health and meeting the community's needs. Here in Lewis and Clark County, the Board of Health has adopted on-site wastewater regulations, soil displacement regulations because of the Smelter Superfund, and most recently, a new rabies regulation. Your Lewis and Clark City County Board of Health is dedicated, like all health department staff, to serving communities across this county, diligently working to protect and improve the health of all residents. Public health stands firmly on the foundation that it takes healthy people to have a healthy community and a healthy economy. Thank you.
This is Kathy Moore, Environmental Division Administrator with Lewis and Clark Public Health. Environmental Health Services works through collaboration with local government, business, and education partners to foster a clean and healthful environment for all residents. We help prevent and reduce blood lead levels in children, monitor our air quality on a daily basis, and work to make it cleaner. We ensure that all septic systems are installed properly to protect our drinking water supplies. We keep water flowing in our streams for farmers, recreationists, and for fish. And we monitor the amount and quality of our water supply for smart growth and development.
My name is Beth. I'm a sanitarian with Lewis and Clark Public Health.
My name is Pete Shade. I'm a hydrologist with the Water Quality District.
My name is Jay Plant. I work for the Lewis and Clark Public Health.
Something I take pride in is a collaborative effort between landowners, developers, and the health department to ensure that septic systems in our county are adequately designed, installed, and maintained to protect our valuable groundwater supplies. Properly functioning septic systems ensure clean drinking water for everyone.
We are prone to wildfire smoke and temperature inversions in the winter months, and a buildup of bad air can lead to aggravated illnesses such as cardiovascular and respiratory illnesses. So it's important that we educate our residents on ways to protect themselves and ways they can protect their fellow residents from bad air pollution.
Through collaboration, education, and intervention, we help prevent and reduce blood lead levels in children living in Lewis and Clark County. By preventing a child's exposure to lead, we increase his or her chances of success not only in school, but in future employment opportunities.
If you live outside the city, chances are you get your water from a well. We at the Water Quality Protection District collect water samples and inform residents of their well water quality.
The data that's collected by the Water Quality Protection District is, data that we know what the water levels are and the water quality is in the at my residence, and it's important for looking at sustained growth throughout the valley.
We monitor and restore stream flows for fish and farmers, for insects and irrigators. Jeff is a resident of the Helena Valley, also the chairman of the Lewis and Clark Conservation District. Jeff, can you tell us what value stream restoration has brought to our valley's farmers and ranchers?
Sure. I can rattle on forever. Everybody knows that there's real value to wildlife, birds and fish and all of that. However, those riparian areas, those restored areas are valuable in that they act as a filter and they clean water, and that clean water is real valuable. I think most folks in the agricultural community realize that cows that have access to clean water are not only healthier, but they're heavier. And clean water pumping through the irrigation systems is a lot less corrosive than muddy, highly turbid water. Therefore, a lot of maintenance savings, cost savings. So all around, restored riparian areas, clean water, it's a good thing for everybody.
Hi there, my name is Eric Merchant, and I'm the Communicable Disease Control and Prevention Division Administrator for Lewis and Clark Public Health. And I'd like to talk to you a little bit today about what we do in my division to protect our community. Within the Disease Control and Prevention Division, we have the Licensed Establishment Program. Under this program, we inspect licensed establishments and review plans for new establishments to assure that they meet requirements for licensure. The objective is to prevent foodborne and other disease outbreaks associated with licensed establishments and seasonal events. Examples include retail food, wholesale food, trailer courts and campgrounds, public accommodations such as hotels, motels, and hostels, pools and spas, and others. We also have an immunization services program. In this program, we provide immunization services to all segments of the local population in order to limit the occurrence of vaccine-preventable disease within our communities. We provide immunization services on a sliding scale depending on ability to pay, insurance coverage, etc. We effectively act as a safety net for community-wide immunizations. All residents will have access to immunization services. We provide travel vaccines, and this is relatively unique to Lewis and Clark Public Health. There are a few exceptions, as some doctors' offices also provide such services. Education and outreach services are critical to health department function. We work closely with local medical providers to ensure they provide immunization services appropriately. We work with our rural school districts, and we also provide seasonal flu, on-site and off-site clinics, special events, etc. for high-risk populations. We also provide back-to-school services and immunizations for our local school population. We have a public health emergency preparedness program. Under this program, the intent is to enhance local public health emergency preparedness and public health capacity to respond to events impacting public health through planning, assessment, and development of preparedness and response activities. An example would be emergency medical countermeasures, where we're dispensing of medical and antiviral assets in the event of a local public health emergency. We conduct tabletop and functional exercises to make sure that we're prepared for public health emergencies. And we maintain a robust health alert network, or HAN system, to facilitate communication during or in preparation for a public health emergency. In our communicable disease programs, we provide communicable disease investigation, control, and testing, for example, for STDs, and prevention services to reduce the occurrence of disease and prevent local outbreaks of local communicable diseases. In this program, registered sanitarians work on zoonotic diseases, such as those that are spread between animals and people, bats, ticks, mosquitoes, etc. We also work on foodborne illness, norovirus, salmonella, and E. coli, and environmental impacts, such as Legionella. Our public health nurses also work in this program, and they work with things that are people-to-people contact, such as flu, pertussis, tuberculosis, sexually transmitted diseases such as hepatitis C, chlamydia, gonorrhea, and syphilis.
Hi, this is Mary Pierce. I'm the home visiting supervisor for Lewis and Clark Public Health. I just wanted to talk to you today a little bit about what home visiting is. Our home visiting programs are prevention strategies used to support pregnant moms and new parents to promote infant and child health, foster educational development and school readiness, and help prevent child abuse and neglect. I want to also talk to you a little bit about the impact of our home visiting services. It is estimated that the cost-benefit analysis shows that high-quality home visiting programs offer return on investments ranging from $1.75 to $5.70 for every dollar spent due to the reduced costs of child protective services, K-12 special education, and grade retention and criminal justice expenses. So, what are the programs that we have here in Lewis-Clark County? We have our Parents as Teachers program that we work in a partnership with Florence Crittenton and AWARE. We have our Nurse Family Partnership. We have Peer Breastfeeding Counselor, Circle of Security Parenting Classes, the Montana Asthma Program, First Breath Smoking Cessation, and our 7 Generations. That program is new to us this year, and our facilitator for Circle of Security is working with incarcerated parents and their caregivers of their children that are under the age of 3 to help reduce the cycle of incarceration. Now I want to introduce you to Audra. She's a mom that has been in our home visiting program. She's received services through Parents as Teachers as well as Circle of Security.
Working with Katie and Greg in the home visiting program was the best step for me. I believe without them, my situation would not have turned out as well as it did, especially because at the time I was homeless with a newborn baby. When I had concerns, we knew who to reach out to and where to get our information from. Provided me tools at home to provide her with the best opportunities that we could, made sure that I knew what I needed to do with her while I was at home. They were paramount for my postpartum because I wasn't able to function by myself. I think that the program is incredibly beneficial for all parents because you never know how much you don't know. And I don't think we would be where we're at today without them.
Hi, my name is Sherry Winchell, and I'm going to be presenting on the Women, Infants, and Children program today, otherwise known as WIC. So who do we serve on WIC? WIC serves pregnant and postpartum women and their kids up to age 5. Families must meet income eligibility criteria, which means the family must be at or below 185% of the poverty line. What to expect from WIC appointments? WIC offers nutritious foods, a visit with a registered dietitian, and connection to community resources. As for the food packages, participants get approximately $500 a year towards food benefits. Food packages include fresh fruits and vegetables, dairy, protein, whole grain foods and cereals, juice, and infant formula and foods. Visits with a registered dietitian include nutrition education on basically any topic that the family seems necessary or important, along with breastfeeding support. And we also have a WIC peer breastfeeding counselor that helps moms be successful with breastfeeding their babies. And then as far as connection to community resources, we provide access to all sorts of programs in the Helena area, including home visiting programs, AWARE, Child Find, child care programs, affordable housing, and Head Start, just to name a few. Benefits of WIC. Why is the WIC program important? The two main things are lifelong healthy habits and prevention. So WIC shows that studies have shown that WIC kids are more likely to eat more fruits and vegetables than other kids of the same socioeconomic status. And WIC participants are more likely to have diets that are adequate in calcium, iron, and folic acid than kids who don't participate in WIC. As for prevention, WIC kids are less likely to have early childhood dental decay, pregnant women on WIC are less likely to deliver low birth weight infants. And a recent study in 2019 shows us that every $1 invested in WIC saves about $2.48 in medical, education, and productivity costs.
Hi, I am Sarah Sandell, the Prevention Program Supervisor for Lewis and Clark Public Health. The prevention team is made up of tobacco prevention, cancer screening and prevention, suicide prevention, the Connect referral system, behavioral health systems improvement, and I focus on physical activity, nutrition, and the built environment. I focus on a variety of prevention practices and strategies. A few of them are listed on the screen. I help facilitate organizations to create workplace health programs, which consist of a coordinated and comprehensive set of health promotion and protection strategies that are designed to encourage the health and safety of all employees. Workplace health programs can reduce direct and indirect related costs due to poor health, improve employee health and productivity, and can improve employee recruitment and retention. Healthy and happy employees stay longer. I also focus on the importance of our built environment. Why? Because when we have a safe, inclusive, and connected sidewalks, paths, streets, people are able to live healthier and more independent lives. We do this via community engagement through facilitating and participating in walk audits, which are ways to look at specific areas to see if they are inviting, safe, inclusive, and engaging. We are also part of the group that is focused on creating a unified, coordinated, and community-driven wayfinding plan. Along with Melissa, I also lead 2 different chronic disease self-management programs for community members and organizations. One being Living Life Well, which is a series aimed at creating tools and skills to help a person manage their chronic illness. It is a 6-week series that has topics around physical activity, nutrition, goal setting, talking with your provider. I also lead Walk with Ease, which is a walking program. Both of these are hosted by the Montana Arthritis Program, and these classes have been found to decrease depression, fear, and frustration around one's chronic health condition, increase physical activity, decrease emergency room visits, and more. The goal of these strategies are to create a healthier, happier, and more physically and mentally well community. I will now pass it along to my next team member who will talk more about the amazing work we do. Thank you.
Hi, I'm Nate Wellington, Tobacco Use Prevention Health Educator for Lewis and Clark Public Health. My program has 4 goals. The first is to prevent tobacco use among young people. I do this by educating and engaging youth in tobacco prevention activities, and last year, 800 plus youth were engaged. The second goal is eliminating exposure to secondhand smoke. I provide smoking policy support and signage to businesses, which strengthens the Clean Indoor Air Act. Third goal is to promote quitting among adults and youth. I do this by promoting and educating about the 4 quit lines here in Montana, as well as the many community resources for tobacco cessation. The fourth goal is to build community support and capacity for tobacco prevention. We've done this by engaging community partners in tobacco use prevention topics such as smoking distance resolutions, coalition work, encouraging cessation, and policy work. I also wanted to share some of the local statistics on e-cigarettes among youth in our community, as well as show some of the new products and devices on the market to target youth and create new tobacco users. In Lewis and Clark County, 68.7% of high school students reported trying an e-cigarette product, and 48.5% reported currently using an e-cigarette product, according to the 2019 Youth Risk Behavior Survey. Below you can see these products come in many flavors, from fruit flavors to candy lookalikes. You can see that devices have been made to look like watches or to fit into sweatshirts for discreet use as well. With new products emerging every day, our goal is to educate and minimize youth usage and access to these products. I will now pass it along to my next teammate to highlight their program. Thank you.
Hello, I'm Melissa Baker, Breast and Cervical Health Program Health Educator at Lewis and Clark Public Health. My program's primary goal is to provide quality screening services to Montana women, as well as education about cancer prevention in a manner that is appropriate, accessible, and cost-effective. Women who are uninsured or underinsured and who cannot afford to pay for cancer screening and diagnostic services can enroll in the program in order to have those services paid for. Screening services include mammograms, clinical breast exams, Pap tests, and pelvic exams for the early detection of breast and cervical cancers. Diagnostic testing, which includes things such as biopsies and breast ultrasounds, is also provided for the follow-up of abnormal screening test results. In addition, any woman, regardless of income and insurance status, who has difficulty navigating the healthcare system can sign up to receive patient navigation services, which includes things like referrals to Medicaid and the insurance marketplace, assistance in finding a healthcare provider, and guidance in scheduling appointments and understanding test results. Remember, early detection is the best prevention.
Good morning. My name is Jess Hegstrom, and I'm the Suicide Prevention Coordinator here at Lewis and Clark Public Health. The Suicide Prevention Program aims to create a network of support through education, awareness, prevention, and postvention efforts. Essentially, we're trying to educate our entire community to recognize warning signs, to respond appropriately, and to get people to the care they need to prevent an unnecessary death. So we're doing this through a variety of strategies. We have the Lewis and Clark Suicide Prevention Coalition, which meets monthly and involves a variety of stakeholders in our community. We do mental health awareness and suicide prevention training, which is funded by a grant from the Substance Abuse Mental Health Services Administration. That grant does end this year, but we are training workforce as well as the general community in a variety of evidence-based programs. We're also involved in a program called Safer Communities Montana, and it's all about reducing access to lethal means by people at risk, and we're doing this through collaboration with the firearm and pharmaceutical communities. We also provide military cultural competency awareness and education to our civilian friends and neighbors, and then also awareness activities such as the East Helena Out of the Darkness Campus Walk through partnership with the East Helena Suicide Prevention and Awareness Coalition, and finally we do postvention through an effort called the International Survivors of Suicide Loss Day. Postvention is the steps that we take after someone has died by suicide. And essentially, postvention is prevention because those who've had a suicide loss are simply more at risk of taking their lives themselves. So this is why we put on the International Survivors of Suicide Loss Day event. Rather than explaining it, I'm going to have a community member tell you a little bit about the program.
My name is Julie Strong Bethke. I lost my husband, Daniel Bethke, to suicide on December 17th, 2010. I just felt completely alone, almost like I was going crazy because of the feelings I was having. Never felt like that before. I believe people in our community are hurting when they lose someone to suicide, and one of the best ways of helping them is Survivors Day, because it opens up other avenues of ways to get them help. It helped me realize that I'm not alone in this journey, that there's other people that are hurting, and it opened up, a new way for me to see other people and make new friendships, and friends that I've had from the day of my loss till now, which has been 10 years this month. Survivors Day is the one thing I always look forward to because of all the information that you obtain, and just like I said, seeing other people and meeting people from different areas. It just helps people, feel like I said, feel like they're less alone. They're not going crazy, that, life can go on and you can be happy.
Hi everyone, my name is Julie Burr, and I'm the Connect Referral Coordinator. Connect is a statewide electronic referral system. Connect is free for providers of all types, including medical, social service, behavioral health, and more. These agencies can send referrals on behalf of their clients to other providers and resources in the community. For example, a therapist can easily refer their client to WIC or home visiting through Connect with the signed release from the client, and then our program staff will call the client to get them started. The client benefits because the provider they already work with is able to connect them to services directly. They are then contacted by the agency which receives the referral, taking the burden off of the client of having to reach out on their own. Connect also streamlined the referral process for providers in many ways, by making it easier to connect clients to resources, to find available providers, and to follow the client's engagement with the referral. Connect is helping our community to build a network of support to help those who need it most get the services they need. We'll now hear from a Connect user at St. Peter's Health about why Connect is important to her team.
Hi, I'm Haley Weismiller with the Population Health and Complex Care team here at St. Peter's Health. The Connect referral system has been an incredibly valuable tool for us. It allows our care teams to streamline referrals to community-based or social service organizations in our community and at times the state. Now with our use of Connect, we're able to communicate any pertinent information about the individual's case directly to the organization receiving the referral. And in turn, we receive updates about the status of the referral, any connections made, and the services the patient is now receiving. This is incredibly important to us because it ensures that our continued interactions with the patient and any care given to the patient is the most effective and efficient and is delivered in context of these additional services they're receiving. Another benefit of the Connect system is that the resource identification process is made much easier and it's up to date. So referrals can be initiated in real time with the patient on the phone or in the office. And this helps ensure that the care transitions are seamless. So ultimately for us, it saves care coordination time, it increases successful connections to resources, and it allows for us and the community to care for our patients more holistically.